When the nurse stopped typing and stared at her hands, the entire situation shifted slightly because people pretending to be sick usually want attention, but she had been trying unusually hard not to speak at all.
Don't waste your time, my mom told the ER nurse before I could even answer. She does this for attention every few months. I felt my throat tighten instantly. Every time I tried to speak, she cut across me like I wasn't even there. And the worst part was, people believed her. The nurse barely looked at me before typing something into the chart. Before we continue, please hit the like button, subscribe to the channel, and turn on the notification bell for updates. I was 17, shaking in a wheelchair under the freezing hospital lights at almost midnight, while my mom calmly explained my symptoms away like she'd rehearsed it 100 times before. She reads medical stuff online and convinces herself she's dying, she added with this tired little laugh. The nurse nodded, but then her eyes dropped to my hands. Just for a second, her expression changed. And suddenly, she stopped typing. My fingers were trembling against the armrest hard enough that I had to press them down to keep them still. I noticed the nurse staring at the bluish color around my nails before she looked back up at my mom. It's anxiety, my mom said quickly, like she needed to correct the room before anyone else could think something different. She works herself up until she can't breathe. The nurse finally looked at me directly. How long have you been having chest pain? Before I could answer, my mom stepped closer to the desk. On and off for years. It's never anything serious. Years. That part was true. What she didn't mention was how many times it had happened. The collapsing after gym class, the time I blacked out in the grocery store, waking up in the middle of the night with my heart pounding so hard I thought something inside me was tearing apart. Every single time, my mom had an explanation ready before I did. Dehydration, stress, hormones, attention-seeking. After a while, people stopped asking me questions entirely. A resident walked past holding a tablet and glanced at my chart. History of panic attacks? He asked. Yes, my mom answered immediately. I opened my mouth. I was never actually... She spirals if people feed into it, my mom interrupted smoothly. The resident gave me one of those careful looks adults use when they already think you're unstable. Then he nodded and walked away. I could feel the pressure building in my chest again. Not panic, something heavier, sharper. I pulled my phone tighter in my hoodie pocket where I kept months of saved heart rate recordings and symptom notes nobody had ever seen. Because every time I tried showing someone before, my mom found a way to explain that away too. The nurse turned back to the computer screen, scrolling silently through my records now instead of typing. Then she paused. Her eyes narrowed slightly. Dana, she said carefully to my mom, can you give us a minute? My mom's expression changed instantly, and for the first time that night, she looked nervous. What the nurse found in my chart wasn't supposed to matter anymore. My mom didn't move right away. She stayed planted beside my wheelchair with one hand gripping the handle, like if she let go, she'd lose control of the entire situation. Why? She asked flatly. The nurse kept her tone polite. I just need to ask Trisha a few standard questions privately. There was a short silence that felt way longer than it actually was. Then my mom exhaled sharply and stepped back. Fine, but don't encourage this behavior. She walked a few feet away toward the vending machines, still watching us. The second she was out of hearing range, the nurse turned the monitor slightly toward herself and lowered her voice. Have you ever been seen at Riverside Medical before? I nodded slowly. Last year. She clicked through something on the screen again. Do you remember a cardiology referral? My stomach tightened. Barely. I remembered sitting in another exam room while a doctor mentioned additional testing. But afterward, my mom told me it was routine. Nothing urgent, nothing serious. The nurse studied me carefully. Did you ever go to that appointment? No, I said. My mom said they reviewed everything later and decided it wasn't necessary. The nurse didn't answer immediately. That bothered me more than if she had. Across the waiting area, my mom crossed her arms the second she noticed us still talking. Even from a distance, I could tell she was irritated. The nurse looked back at the chart. "Trisha, have you been fainting often?" I hesitated. "Sometimes." "How often is sometimes?" I swallowed. "A few times a month lately?" Her expression shifted again, more serious this time. Because according to my chart, that wasn't new information. Over the last 2 years, I'd collapsed at school twice, once during volleyball practice, once walking upstairs at home. There were ER visits, urgent care notes, complaints about chest pain, dizziness, numbness in my hands. But somehow every appointment ended the same way. Anxiety. Stress response. Teenage attention seeking. The nurse scrolled farther down the records, then stopped completely. "Trisha," she said carefully, "why were you referred for genetic cardiac testing?" I stared at her. Because nobody had ever told me I was. And suddenly, for the first time, it felt like my mom hadn't just been dismissing my symptoms. It felt like she'd been hiding something. That was the moment I realized my mom controlled more than just the conversation. The nurse kept looking at the screen while I tried to process what she just asked me. Genetic cardiac testing. Not anxiety screening, not counseling, cardiac. "I never saw any referral," I said quietly. The nurse glanced at me. "You're a minor. Were your records managed through your mother's account?" I nodded. That answer seemed to confirm something for her. Behind us, the automatic ER doors slid open as paramedics rushed another patient inside. The noise in the waiting area picked up for a second, but around me, everything still felt strangely focused, like the room had narrowed down to the monitor beside my chair and the chart on that screen. "My mom handles everything," I admitted. The nurse leaned back slightly. "Has anyone ever explained why Riverside recommended follow-up testing?" "No." Before she could respond, a sharp pain spread through the center of my chest so suddenly that I grabbed the armrest. The heart monitor clipped to my finger jumped. A rapid series of beeps cut through the room. The resident from earlier looked over immediately. "What happened?" "She's panicking again," my mom said before I could even breathe properly. She was already walking back toward us. "This is what I was trying to tell you." "I'm not panicking," I managed, but my voice sounded weak even to me. The resident glanced at the monitor. The numbers had already started settling back down. "Probably anxiety-related tachycardia," he said casually. My mom gave this exhausted little nod, like she'd won an argument nobody else understood. But the nurse didn't agree. I noticed it in the way she kept watching my hands instead of my face. "Trisha," she asked carefully, "has anyone in your family ever had heart problems? Sudden death? Fainting episodes?" "No," my mom answered instantly. Too instantly. Because I remembered things she apparently thought I didn't. Whispered conversations after funerals. An uncle who collapsed unexpectedly in his 20s. My grandmother dying younger than everyone expected. The nurse noticed my hesitation immediately, and so did my mom.
When someone answers a family history question that fast, especially after a physical symptom shows up, it usually means the conversation isn't actually about anxiety anymore.
"Don't start making things up now," she snapped quietly at me. That was the first time all night her voice sounded nervous instead of confident. Then the monitor beside me suddenly screamed with a loud, uneven burst of alarms. The nurse looked down at the screen, and her entire expression changed. The room changed before anyone even explained what was happening. The nurse grabbed the monitor cable and adjusted it quickly like she thought it might be malfunctioning. But the alarms kept going. Fast, uneven, wrong. The resident stepped closer now, no longer relaxed. "What's her pulse?" The nurse checked manually against my wrist. Then she looked up immediately. "It's accurate." For the first time since we arrived, nobody was looking at my mom anymore. All the attention shifted to me. I told you she works herself up, my mom said, but there was strain in her voice now. She does this when people start feeding into— Ma'am, please, the nurse interrupted sharply. That shut her up. I'd never heard anyone cut my mom off before. The nurse pulled my chart back onto the screen while another staff member wheeled over additional monitoring equipment. What exactly did Riverside flag? The resident asked. The nurse turned the screen toward him briefly. Recurrent syncope. Oxygen desaturation during sleep. Family history concerns. Possible inherited cardiac or connective tissue disorder. The resident's expression changed instantly. He looked at me differently after that. Not suspicious, not cautious, concerned. My mom stepped forward again. They told us it was probably nothing serious. Who told you that? The nurse asked. My mom hesitated, just for a second, and that tiny pause felt bigger than everything else that night. Because up until then, she'd had an answer for everything. The resident crouched slightly beside me. Trisha, has anyone ever explained the risk of arrhythmia to you? I shook my head slowly. No. My mom folded her arms tightly. You're all overreacting. But now she sounded like she was trying to convince herself, too. Another doctor rushed over after reviewing the live monitor feed from the desk station. He looked directly at the screen, then at me. How long has she been having episodes like this? Years, the nurse answered before my mom could. The doctor's face hardened immediately. Why was there no follow-up after Riverside? Silence. My mom opened her mouth, but nothing came out. The monitor suddenly let out another violent burst of alarms. The nurse looked down once. Then she reached behind the desk and slammed her hand onto the emergency button. And that was the moment my mom finally looked scared. Everything after the emergency button felt fast and controlled at the same time. People flooded into the room almost instantly. A crash cart rolled past my wheelchair. Someone placed adhesive pads against my chest, while another nurse started calling out numbers from the monitor. The calmness disappeared from my mom's face completely. What's happening? She asked, looking around at the staff. She was fine 10 minutes ago. Nobody answered her. The doctor beside me was focused entirely on the monitor now. Her rhythm's unstable, he said to another nurse. Prep cardiology. I barely understood half the words being thrown around, but I understood the look on everyone's faces. This wasn't anxiety anymore. One of the nurses helped move me onto a hospital bed while another adjusted oxygen tubing near my face. My chest still felt tight, but now adrenaline was cutting through the fog enough for me to notice something that had never happened before. Every question was directed at me, not my mom, me. Trisha, stay with us. Trisha, when did the chest pain start? Trisha, have you ever blacked out during exercise? Meanwhile, my mom stood frozen near the wall while the staff worked around her like she wasn't controlling the room anymore. A cardiologist arrived maybe 15 minutes later carrying a tablet with my records already pulled up. He reviewed the monitor readings, then looked toward the nurse. She should have been worked up for inherited cardiac disease a long time ago, he said quietly. The room went still again. He explained that Riverside had flagged multiple warning signs over a year earlier. My fainting episodes, oxygen drops during sleep, exercise intolerance, family history, and abnormal rhythm patterns together pointed toward a serious inherited connective tissue and cardiac condition. Not stress, not attention-seeking, not panic attacks. My mom's face lost color as he continued. According to the records, Riverside specialists had recommended urgent genetic testing and long-term cardiac monitoring. Appointments had been scheduled, then canceled. Follow-ups were missed repeatedly. Notes from previous doctors showed a pattern too familiar now. Concerns raised, then minimized after conversations with my mother. The cardiologist finally looked directly at her. Were you informed about these recommendations? My mom hesitated again. They said it was only a possibility. That possibility could have killed her, the doctor replied. Nobody said anything after that. I just stared at the ceiling, trying to process the fact that for years I'd actually started believing her. Every time someone rolled their eyes at me, every time a doctor dismissed me, every time I wondered if maybe I really was dramatic, I was getting sicker. The nurse from triage stayed beside my bed while they ran more tests. At one point, she adjusted the blanket around me and said quietly, "You should have been listened to a long time ago." That hit harder than the diagnosis itself, because nobody had ever said that before. By morning, the hospital had already documented concerns about possible medical neglect. Extended family members were contacted after the doctors pushed for genetic screening history. And suddenly, stories started surfacing. Relatives who died young, heart problems nobody talked about openly, episodes people brushed off for years. The pattern had always been there. My mom finally admitted later that after my dad died, she couldn't handle the idea of losing someone else. So every symptom became something easier to explain away. Anxiety, drama, attention-seeking. At some point, she stopped convincing just herself. She convinced everyone around her too, including me. A few months later, I was in treatment, wearing a heart monitor regularly, actually being taken seriously for the first time in my life. Doctors spoke directly to me now. I had access to my own records. My symptoms were finally manageable because someone had stopped dismissing them long enough to investigate. And honestly, the scariest part wasn't finding out I was sick. It was realizing how close everyone came to letting me die because they believed the wrong person.
The strange part is how many people get labeled dramatic before anyone checks whether the pattern actually makes sense. And honestly, this situation wasn't the most convincing situation I have come across.